Assalamualaikum. Beta, in this video lecture, I will deliver the pathology of cervix. So far we have covered endometrium and all about the pathology, entire ovaries, tumors, and all other conditions. Now it's time for cervix. To have better understanding of the pathology of cervix, you need to have little idea about its anatomy. Okay, beta. Okay, I'll show you the pictures to have better understanding, but you first see here that cervix has got two portions. It is the structure just below the endometrium, and the cervix has got two components. The one is a little structure that is the external vaginal portion, that is called ectocervix, and the above the proximal portion is the endocervical canal, that is also called endocervix. Okay, so if I take you to the picture and you see here, just a second, there we go. Okay, so here in this picture you can see beta, if I just zoom into this further, there you come to see that this entire is the cervix. This entire from here till here, it is the cervix. Okay, can you see it is having two parts? This nice little part that is present inside the vagina, this is called the ectocervix, or external vaginal portion. And this portion of the cervix, this portion, yeah, this portion of the cervix, this is called endocervix. Okay, this is the endocervical canal. This is the endocervical canal, and this portion which is present in the vagina, this is called ectocervix. Okay, and there is a nice little structure which is connecting this ectocervix to endocervix. This is the external os. Okay, this is the external os, right? You can see this is the external os. This part is the ectocervix in the vagina, and this canal is the endocervical canal or the endocervix. Okay, above the vagina. Now, to very important point which you have to mention is the lining epithelium of this ectocervix portion. The lining epithelium of this ectocervix portion and this entire vagina is a squamous epithelium. Okay, so if I mention that this ectocervix and this vagina, they are lined by the squamous epithelium. They are lined by squamous epithelium. Okay, and this endocervix, that is the endocervical canal, it is not lined by the squamous epithelium. It is lined by columnar epithelium. It is lined by columnar epithelium. Okay, so this is the endocervical canal, this is ectocervix, right? I hope you are clear so far. Okay, this junction, look, this endocervix having columnar epithelium, this ectocervix having squamous epithelium. The junction point of endocervix and the ectocervix, this junction point, this opening is external os. This opening is external os, but this entire is lined by the columnar epithelium, and this is lined by squamous epithelium. So this junction where this columnar epithelium is ending and this squamous epithelium is starting, that junction is called squamo-columnar junction. That is called squamo-columnar junction. And even I can draw the same thing here to have the better understanding. Okay, then you can see beta, this is nice little part. Okay, and then comes this, like, okay, and I don't know if it is really okay, there we go. Okay, so you can see this part is endocervix and this part is ectocervix. Okay, and this ectocervix is down there in the vagina. This ectocervix and this vagina is lined by squamous epithelium. This endocervix is lined by columnar epithelium. Okay, and this opening is called external os. Okay, so the junction of this columnar epithelium and this squamous epithelium, this junction is called squamo-columnar junction. Okay, and the level of this junction beta may vary. This level of the squamo-columnar junction changes with the increasing age and due to some influence of the hormones. So let's see now onwards beta. Let me just zoom into it further. That you can see the position of the squamo-columnar junction. That is the junction between the squamous epithelium of the ectocervix and the columnar epithelium of the endocervix. It is variable and it changes with time. Okay, it changes with time and with increasing age and the influence of the hormones. Okay, generally it moves upwards into the endocervical canal with time, leading to the replacement of the columnar glandular epithelial cells by advancing squamous epithelial cells, and this process is called squamous metaplasia. Okay, now let me explain you what does it mean, beta, quickly. That okay, yeah, this is the same picture. This is the same picture. If I can adjust it here, okay, yeah, this portion is the endocervix, it is lined by columnar epithelium. This portion is the ectocervix, it is lined by squamous epithelium, and this junction is called squamocolumnar junction. The level of this squamocolumnar junction with age, it goes above, that means the squamous epithelial cells are moving upwards and they are replacing the columnar epitheliums, say columnar epithelial cells. तो बेटा आप फर्ज करें कि ये है ऊपर endocervix, it is lined by columnar epithelium, and this is the ectocervix, it is lined by स्क्वामस एपिथेलियम. तो वक्त के साथ क्या होता है, ये स्क्वामो कॉलमनार जंक्शन है, ठीक है. वक्त के साथ क्या होता है, ये जो जंक्शन है ना स्क्वामो कॉलमनार जंक्शन, ये ऊपर आता जाता है, यानी कि जो आपके स्क्वामस सेल्स हैं वो ज़्यादा होने लगते हैं और फिर आपके जो कॉलमनार सेल्स हैं वो कम होने लगते हैं. ओरिजिनली ये यहाँ तक था, एग्जैक्टली ये यहाँ तक था, लेकिन उसके बाद क्या हुआ, जो स्क्वामस सेल्स से नीचे उन्होंने ऊपर कॉलमनार सेल्स को रिप्लेस कर दिया. तो ये दिस इज कॉल्ड बेटा, दिस जोन इज कॉल्ड ट्रांसफॉर्मेशन जोन, एंड दिस प्रोसेस ऑफ रिप्लेसमेंट ऑफ द कॉलमनार सेल्स बाय द स्क्वामस सेल्स, दैट इज कॉल्ड स्क्वामस मेटाप्लेजिया. यू अंडरस्टैंड? इनिशियली दिस वाज द ectocervix that was having squamous epithelium, and this was the endocervix having the columnar epithelium, and this junction of the squamous and the columnar epithelium was called squamocolumnar junction. But with age, with increasing age, this junction, you can now see, initially it was here, now it has come up to here, and this means these squamous cells have been increased, and the cells that were actually present here, that were the columnar cells, they have now been replaced with the squamous cells. And this zone where the cells have been replaced, or where the cells are being replaced with the squamous cells, this zone is called the transformation zone, and this process is called squamous metaplasia. Right, I hope you are clear with this, beta. Okay, the unique epithelial environment of the cervix, what does it mean? The unique epithelial environment of cervix, what does it mean? The presence of the immature squamous metaplastic epithelial cells. Here in this transformation zone, the columnar cells are being replaced by the squamous cells, and the new squamous cells which are coming here, they are very much immature. Okay, they are immature squamous metaplastic epithelials, due to which there is increased susceptibility to HPV infections with the human papilloma virus, and which is the main cause of cervical cancer. Now you understand, beta. This is the transformation zone where initially there were the columnar cells, but now squamous cells are replacing the columnar cells. This cell, this portion, this zone, now there are immature squamous cells, and those immature squamous cells are, at high risk of developing the HPV infection, that is the human papilloma virus infection, and ultimately the development of beta cervical cancer. Okay, let's now start with beta the inflammation of the cervix, that is called cervicitis, acute and the chronic cervicitis. To have better understanding, let's see what is happening normally. This entire lecture is beta from your textbook Robin Spaces. Okay, so beta, just a little physiology to see what is actually happening physiologically in your cervix, then we will see if there is defect in that physiology, how the pathology develops, how the inflammation occurs. So beta, at the onset of the menarche, around the age of 12 to 13 years, obviously your ovaries starts producing lots of estrogen. And what does this estrogen do? This estrogen causes maturation of cervical and vaginal squamous mucosa, and the formation of the intracellular glycogen vacuoles in the squamous cells. You understand? cervical और vaginal mucosa जो है बेटा, squamous mucosa जो है ज़ाहिर squamous epithelium में, उसके जो cells हैं squamous cells, उनके अंदर glycogen के vacuoles का बनना start हो जाता है, और वो cells बहुत young, बहुत active हो जाते हैं, ठीक है, और बहुत nutritious cells होते हैं. और बेटा जब ये सेल्स शेड करते हैं वजाइनल मिकोजा के, सर्वाइकल मिकोजा के, तो जाहिर है बेटा इन शेडिंग ऑफ सेल्स से क्या होगा, उनके अंदर जो ग्लाइकोजन मौजूद था वो रिलीज हो जाएगा. सो दैट दिस ग्लाइकोजन इज एक्चुअली यूटिलाइज्ड बाय द एंडोजिनस वजाइनल वजाइनल एंड सर्वाइकल एरोब्स एंड एनएरोब्स. ओके, तो नॉर्मली जो बैक्टीरिया मौजूद होते हैं आपके वजाइना में, सर्विक्स के अंदर जो बैक्टीरिया मौजूद होते हैं, तो बैक्टीरिया सर्वाइव कैसे करते हैं, इसी ग्लाइकोजन से सर्वाइव करते हैं. और ये ग्लाइकोजन कहाँ से आया, जो सर्वाइकल और वजाइनल मिकोजा के सेल्स शेड हुए थे, जो कि नॉर्मली वियर टियर होता रहता है सेल्स का. तो जब सर्विकल और वजाइनल मिकोजा के सेल्स, उनका वियर टियर होता है, सेल्स टूटते हैं, तो उनके अंदर से ग्लाइकोजन निकलता है, और ग्लाइकोजन इज़ यूटिलाइज्ड बाय द एरोब्स एंड एनएरोब्स इन द सर्विक्स एंड द वजाइना. ओके, और फिर बेटा जो वो बैक्टीरिया है, स्पेशली द लैक्टोबैसिलाई, जो कि नॉर्मल वजाइनल फ्लोरा है, तो ये तो बड़ा खुश हो जाएगा ये बैक्टीरिया. दिस बैक्टीरिया विल बी हैविंग हैप्पी लाइफ, एंड दिस बैक्टीरिया इज एक्चुअली वेरी गुड फॉर यू, बिकॉज दिस बैक्टीरिया प्रोड्यूसेस लैक्टिक एसिड and maintains the vaginal pH acidic, that is around 4.5. This acidic pH will suppress the growth of other saprophytic and pathogenic organisms. ठीक है, इस बैक्टीरिया को आपने क्या दिया बेटा, ग्लाइकोजन दिया रहने के लिए, और बदले में इस बैक्टीरिया ने क्या दिया आपको, प्रोटेक्शन फ्रॉम अदर बैक्टीरिया. ओके, by maintaining the vaginal pH acidic. Okay, what else this bacteria can do, lactobacilli, at low pH they also produce a very important enzyme, that is the bacteriotoxic hydrogen peroxide. Okay, this is not a enzyme, this is not an enzyme, this is a very important molecule, that it is a, yeah, bacteriotoxic hydrogen peroxide. This is really good molecule to be understand, that it does not allow the growth of the bacteria, it is bacteriotoxic. Okay, so this is how lactobacilli is helping you, right? Then beta, okay, if I take you here, then you can see that if the pH becomes alkaline, due to whatever reasons, it can be the bleeding, sexual intercourse, or the vaginal douching, or due to some antibiotics that suppress the lactobacilli, there will be decreased H2O2 production, okay, by the bacteria. This will allow the overgrowth of other microorganisms that will cause the infection and inflammation of the vaginal and the cervical mucosa. Okay, that will lead to the cervicitis and the vaginitis. So now the question is, beta, normally there were like lactobacilli that were present in your vagina, and that lactobacilli were the actually bacteria that were utilizing your glycogen, and they were producing lactic acid and bacteriotoxic compounds, so to prevent the infection by the pathogenic bacteria. लेकिन अगर वो देखिए, लैक्टोबैसिलाई का काम एसिडिक पीएच मेंटेन करना, लेकिन अगर एसिडिक पीएच ना रहे और पीएच अल्कलाइन हो जाए, पीएच के अल्कलाइन होने के क्या रीजंस हो सकते हैं, मेंस्ट्रुअल ब्लीडिंग हो सकती है, सेक्सुअल इंटरकोर्स के दौरान वजाइनल कैनाल में, एंडोसर्विकल एक्टोसर्विक्स में सीमेन का आना, जिसकी वजह से अल्कलाइनिटी हो जाती है, वजाइनल डाउचिंग वेयर यूर वजाइना बिकम्स अल्कलाइन, और कुछ एंटीबायोटिक्स होती हैं दैट कैन सप्रेस द लैक्टोबैसिला, और जब लैक्टोबैसिला सप्रेस हो जाएंगे तो लैक्टिक एसिड नहीं बनेगा और बेटा वैसी अल्कलाइनिटी हो जाएगी. ओके, सो अल्टीमेटली जो बैक्टीरिया से हाइड्रोजन पेरोक्साइड बन रहा था लैक्टोबैसिलाई से, वो कम बनेगा, और एसिडिक पीएच मेंटेन नहीं रहेगी, तो अल्कलाइनिटी हो जाएगी, और बेटा दिस विल अलाउ द growth of other pathogenic microorganisms that will cause infection and the inflammation of the cervix and vagina, leading to cervicitis and the vaginitis. Some degree of cervical inflammation is found virtually in all the women. It's normally it occurs, माइनर सी इन्फ्लेमेशन चलती रहती है सर्विक्स के अंदर और वजाइना के अंदर, लेकिन इसके कोई इतने बड़े कॉन्सिक्वेंसेस नहीं होते. लेकिन हाँ, अगर ये जो इन्फ्लेमेशन है कोई बहुत ज़्यादा पैथोजेनिक बैक्टीरिया की वजह से हो जाए, जैसे कि गोनोकोकाई, दैट्स नज़ेरिया गोनोरिया, और द क्लेमाइडिया ट्राकोमेटिस, या फिर माइकोप्लाज्मा, या हर्पिस सिम्प्लेक्स वायरस की वजह से हो जाए, तो दिस विल प्रोड्यूस द सीवियर acute or chronic cervicitis. And when you perform the PEP test, this will give you the abnormal results due to the shedding of the atypically appearing squamous cells. You now understand this, beta? What did I say you? If I recap the entire thing, that in your cervical and vaginal mucosa, there are very much healthy squamous cells that contain glycogen. And when these cells shed due to normal physiologic process, they release glycogen that was stored in their cytoplasm. And that glycogen is utilized by the lactobacilli present in the normal flora of the vagina and the cervix. And then as a result, what do these lactobacilli do? These lactobacilli are really good. These lactobacilli are really good. And they do help you by preventing the further, infection by another, pathogenic bacteria. And if let's suppose, okay, how do these lactobacilli do this? How do they prevent you from other pathogenic bacterial infections? Lactobacilli maintain the vaginal pH acidic. This is the reason other bacteria cannot grow. But if let's suppose due to some reasons your vaginal pH becomes alkaline, maybe due to the menstrual bleeding, sexual intercourse, or due to some antibiotics that can suppress the lactobacilli, so ultimately क्या हो जाएगा, आपकी जो वजाइनल और सर्विकल पीएच जब अल्कलाइन हो जाएगी तो दूसरे बैक्टीरिया ग्रो कर जाएंगे और बेटा मुमकिन है कि वहाँ पे इन्फेक्शन हो जाए और इन्फ्लेमेशन हो जाए. दैट इज़ व्हाट वी कॉल सर्वासाइटिस. एंड अगर वजाइना में हो तो वजाइनाइटिस. ओके, वैसे ये इन्फ्लेमेशन होती रहती है सर्विक्स में नॉर्मली फिजियोलॉजिकली, लेकिन इसके क्लिनिकल सिग्निफिकेंस इतनी नहीं होती क्योंकि वो सीवियर नहीं होती इतनी. ठीक है, लेकिन अगर इन्फेक्शन कुछ बहुत सीवियर जो बहुत पैथोजेनिक बैक्टीरिया हैं, निजेरिया, गोनोरिया, क्लेमाइडिया, ट्रैकोमेटिस, माइकोप्लाज्मा, हर्पीस सिम्प्लेक्स वायरस, इनकी वजह से हो जाए तो बहुत सीवियर सर्वाइटिस, बहुत सीवियर वजाइनाइटिस हो सकती है. ठीक है, और आप जब पेप टेस्ट परफॉर्म करेंगे तो उसमें ज़ाहिर रिजल्ट्स भी एबनॉर्मल आएंगे क्योंकि जो सेल्स हैं वही बेटा दे आर एबनॉर्मली अपीयरिंग स्क्वामस सेल्स ऑफ योर वजाइना एंड द cervix. Okay, I hope you are clear with this concept of cervicitis and the basics and the anatomy part. Okay, in the later lecture I will deliver the endocervical polyps and then followed by the malignancies of the cervix. That's it beta. Thank you so much.